New York State is pushing back against the CDC's request to collect data from residents who receive the new coronavirus vaccine. The government agency has asked all 50 states to sign an agreement that allows them to obtain personal information from vaccinated people, including names and birthdays. But leaders like Governor Andrew Cuomo believe that the Trump administration is using this moment to deport undocumented people from the country and therefore will not be sharing any information. The CDC has denied these allegations. Meanwhile, the New York governor has released his plan to distribute vaccinations across the state. Cuomo says that he expects to receive 170,000 doses as early as this weekend. Long Island is expected to get a large share of vaccines along with the Mid-Hudson Valley region. So we want to bring in Kathy Hochul. She is the Lieutenant Governor of New York and is joining us now from Buffalo. Thank you so much for joining us, particularly this early in the morning, because we have a lot of questions for you.
No problem.
Lieutenant Governor, do you stand by Governor Cuomo's decision not to give personal information to the CDC? And what were some of your concerns? Because the thing about this vaccine is it takes 2 doses, so you sort of have to keep track of people. You have to make sure that if somebody comes by, they've either gotten the first one or the second one. So what were your biggest concerns about that information being collected?
Well, basically, there was no basis for it whatsoever. The objective is to have as many people living in this country as possible to be vaccinated, or else it's not going to work. You need about 70 to 80% of the U.S. population to be vaccinated for us to finally declare end of this war and get on with our lives and the economy. So why would you leave literally millions of people in the shadows, still exposed? Many of them are workers in our society. The majority of them are working, and they could be exposing themselves and others to the virus at a time when we're trying to have a national effort to vaccinate everyone. So it was insane from the very beginning, and it was very discriminatory. It was basically an effort to collect this data and perhaps share it with other federal agencies and results in people's mass deportation. What a disincentive for people to come forward and be vaccinated. It made no sense from the beginning. So we're so glad that they backed down after Governor Cuomo and our administration stood up firmly and said, this does not make sense when we're battling a pandemic. So back off, and they did.
One of the things that the governor talked about yesterday, too, when it came to the vaccine is that New York in particular has an independent review panel. Why do you think that was necessary?
Well, you think about the fact that all summer long we kept hearing stories about the politicization of the CDC and the FDA. Now, we trust the hardworking doctors and researchers from the very beginning, but you had Trump political hacks infiltrating these agencies, literally changing data, recommendations that went out, but then were reversed a few days later. So there was an inherent distrust of what was going on at the highest levels. So we simply said, in order to build the trust that is necessary to get people to believe in the safety of this information and the safety of the vaccine, we would have our own independent review. It will not hold up the distribution by 1 second in New York State. Our team has been embedded. We're working closely with them. But this was the governor's idea since last July when we said, you know what? We're going to have to do some extra efforts to build confidence in the veracity of what they come up with. We believe it's going to be valid, but we're going to have our second set of review on it going on immediately. And we expect to have the vaccine available literally this weekend in New York State.
Do you worry at all that, particularly with the battle over personal information and now what, you're saying you felt was a necessary thing to have this independent panel just so people could have confidence in the vaccine? You heard the president almost sort of threatened in a way to withhold the vaccine from New York just a few weeks ago, that, in sort of the waning days of the Trump administration that he's continuing to target New York?
We've stopped long ago believing anything the president said, especially when it comes to his former home state of New York. He tries to penalize us every chance he gets. So this is just old news for us. So it's not going to affect our ability to get this vaccination out whatsoever. We would meet him in court and we would win the next day if he tried to discriminate against the state of New York. So that's not going to happen. It's frustrating we've had to deal with these battles. Our battle is the virus. It shouldn't be battling the federal government to do the right thing. But This is only going to go on for a few more weeks. We'll have the President Biden administration working collaboratively with all of us to make sure that the vast majority of Americans, and we need everybody to get vaccinated. So yes, there's been a lot of distrust, but that era is going to come to an end very soon. Thank God.
Governor Cuomo released a bit of a clearer picture when it comes to vaccine distribution. What do you make of it? How do you think things are going to go?
It's going to go great. We've been talking about this since June and July. We knew this day was coming. We're delighted that it's coming at the end of 2020. It gives us the opportunity to focus on our essential workers. But first, we're going to get to nursing home patients and people who serve them in the hospital, in the nursing home setting. Then we're going to get to healthcare workers who face directly with the high-risk patients, people in the hospitals dealing with COVID patients. They'll be right out of the block as well. And then we're going to get to our essential workers. So we have a very well-thought-out strategy, and it really dovetails with what the CDC is recommending as well. So we feel that's, we're consistent with that approach. But we have over 90 distribution centers already set up in the state of New York with the cold storage facilities. We know where they're going. We are working collaborative with our local partners in the healthcare communities. But also, here's our focus in New York State. There are communities of color that have been so hard hit by this virus, where if you're African American, you are twice as likely to die from the virus. We saw this early on when New York City was the epicenter of this virus and the whole world was watching what was happening. So we're not going to let that happen again. We're going to make sure that we have distribution plan, and we're aware that there are healthcare deserts. Not everybody has a family doctor. Not everybody has a Rite Aid or a CVS or Walgreens on their corner in urban areas or in our most rural areas when you think about it. So we're going to be very targeted, getting out to senior centers, the public housing, places, churches and houses of worship, places people trust, because particularly in communities of color, many of them are our frontline workers. They're the ones out there every day when many other individuals can work in the security of their home. They're out there driving the buses, working in the hospitals, working in the grocery stores, working in the restaurants to package up the food. So we need them, and we need them safe, and they're an important part of our economy, and we're going to protect them as early as we can. And that's an important way to make up for the injustice of how many of them lost their lives early on because they could not get the care they needed.
You know, Lieutenant Governor, when people outside of New York think of New York, they generally just think of New York City. But the fact is that there's New York City, but most of New York is made up of small towns. So you're talking about implementing a system that can meet the needs of those living in the inner city, as well as all of those in the small towns with small clinics. They don't have big hospitals. This sounds like a really expensive endeavor. In Washington, D.C., lawmakers are still sort of going back and forth about the type of COVID aid that they're going to hand out and just how much they're going to give to the states. This sounds expensive. How is New York paying for all of this?
Oh, it's phenomenally expensive. And listen, I know those rural areas. I used to represent the most rural conservative part of our state as a member of Congress. So I walked the streets in those small towns. And yes, it is a challenge to get out the vaccines to the rural areas, but we know how to do this. We're prepared. We know how to handle disasters. We're masters at this. We've had to deal with everything in this state. So no one should worry about our ability to get this out to people who need it. Now, the cost is another story. We will pay for this, but it is a disgrace that the federal government does not take on the responsibility of saying this is a national crisis. It's a global pandemic. It's not just a New York problem or a New Jersey problem or a Florida problem. All these states are going to have to incur extraordinary costs on top of the loss in revenues we've all had to suffer. New York State alone is in the hole for $14 billion. That's just where we are right now. And so the federal government has a responsibility. Again, I served in Congress. I know the powers of the federal government. I know what they should be doing. And this is their opportunity to step up. Mitch McConnell, don't be so cruel. There are people in Kentucky who are going to die if they don't get the health care and the vaccine they need. Give money to the states. So we're also very worried about the people that have been just hanging on by a thread to get through this really dark time in their lives. And unemployment has been their lifeline. And the fact that they're going to be terminating over 12 million people, 1 million right in the state of New York by the end of this month, at the peak of our holiday season, I cannot think of anything more abominable than that. So please, Congress, Follow Nancy Pelosi's lead. Follow what Chuck Schumer wants. Get it done for the American people. Help us defray these costs, because this has to be a success. And the only way we get all of our jobs back open, our jobs and our businesses back open, is to have widespread vaccination. We will need money for this as well.
All right, Lieutenant Governor Kathy Hochul, I could talk to you for another 20 minutes or so, but I know you have to go. Really appreciate your time.
Thank you as well. Bye-bye.